You ever heard someone talk about an illness that runs in the family? People sometimes think that they cannot avoid diseases that are part of their family history. However, certain behaviors can help prevent or reduce the threat of diseases, even those that are hereditary. Non-communicable diseases are the leading causes of death and disability throughout the world. A non-communicable disease is a disease that cannot be spread from one person to another. Examples of such diseases include cancer and heart disease. Non-communicable diseases result from conditions within the body. These include improperly formed cells, deterioration of body's tissues or organs, reduced flow of blood, and malfunctioning in the body system. Inherited traits cause certain diseases. Other diseases are related to behavior or the environment. And then by contrast, a chronic health condition is a disease or a disorder that lasts a long time or keeps coming back. Degenerative diseases is a disease that causes continued breakdown in body cells, tissues, and organs as it progresses. An example of that is multiple sclerosis, which you'll learn about next week. Some congenital diseases are caused by heredity, while others are caused by a mother's choice of lifestyle while pregnant. Congenital disorders are all disorders that are present when the baby is born. Certain diseases can pass from parents to children by means of genes. These include heart disease, cancer, and diabetes. Some illnesses, such as Down syndrome, are caused by birth defects. In some cases, personal choices help determine whether an individual will develop an illness that runs in the family. As mentioned, heredity is the passing of traits from parents to the children. Example of traits that can be passed are eye color, sickle cell anemia, and others. There are lifestyle choices that you cannot control, and those include heredity, as we talked about, where certain diseases can be passed from parents to children by means of genes. As like you can mention that you cannot control who your parents are, so you are almost inheriting those genes. Age, it is inevitable that as we grow older, you are more susceptible to diseases. Gender, the difference between males and females. There are a few diseases that only females acquire, while the same goes for males. Ethnic group, depends on your ethnicity, will determine what kind of diseases you are inherited. Factors that you can control by eating a healthy diet on a day-to-day basis, staying physically active, getting at least 60 minutes of exercise per day, maintaining a healthy weight, the difference between an apple shape and a pear shape. Apple shapes carry their weight around the waist area, and they're more susceptible to diseases such as heart disease because that the fat is closer to their organs compared to a pear shape. A pear shape is someone who has all of their weight around their hip area. Getting enough sleep. Adults should be getting about 6 to 8 hours of sleep. Managing your stress levels and avoiding tobacco, alcohol, and other drugs. Environmental factors can increase the risk of non-communicable diseases. For example, exposure to ultraviolet rays may increase a person's risk of skin cancer. Secondhand smoke can cause lung cancer. Because stress raises blood pressure, long-term exposure to a stressful environment can harm a person's health. Carbon monoxide in high levels can cause illness and deaths. As mentioned before, like secondhand smoke or smog can cause respiratory and breathing problems in some people. There was a case not too long ago where a factory was in a nearby neighborhood, and many of the residents at the nearby neighborhood have acquired cancer, and they think that it is directly related to living close to a factory. Some common non-communicable diseases are the various types of cancers, heart disease, high blood pressure, stroke, heart attack, arteriosclerosis. These are going to be mentioned in the next topic. Common non-communicable diseases, type 1 and type 2 diabetes. The difference between both of them is type 1 that you are either born with it or acquire it from a young age. Type 2 diabetes is where you acquire it from at an older age, and is when your body isn't able to digest or use the glucose and have insulin projected to that area. Arthritis, which is the inflammation of joints. Allergies. As the years go on, more and more people have different types of allergies, whether it's gluten, peanuts. It can be as big as strange as like kiwi. And also there's people who are allergic to mold, pollen, and so forth.